I was talking about the medications that Hemy Neuman is taking. You're familiar with the side effects for those medications, right?
Yes.
And specifically with respect to Remeron, some of those side effects are dizziness, right?
It can be.
Drowsiness.
Yes, it can be.
Lightheadedness.
Can be.
Increased appetite.
Yes, people on Remeron tend to gain weight.
Okay.
And again, these are side effects that can potentially occur with the medication.
Right.
Plenty of people take these medications and don't experience any side effects.
Right, and anybody who takes medication is advised of side effects, right? Potential side effects.
Yes.
Right, and so it's the same with these medications.
Yeah, they should be advised of potential side effects.
Dry mouth.
Can be.
Constipation.
Yes.
Tremors.
With Remeron?
Yes. No.
Maybe an overdose.
Swelling of the hands and feet.
I think you're getting now toward adverse effects.
Okay.
Where someone might have this in a really extreme case, if they might have an allergy or again, some sort of adverse effect.
Okay.
If I'm prescribing Remeron to someone, I typically do not tell them that they might have swelling of the hands and feet. That's
Okay.
just not something that happens.
But if
What's the
they,
difference between a side effect and an adverse effect?
A side effect is a common occurrence. Again, a side effect of Remeron would be sleep and weight gain. I will prescribe Remeron to people who are underweight and who need to gain a little bit of weight. I prescribe Remeron to people and also depressed. I prescribe Remeron to people who don't sleep and who are depressed. An adverse effect is when you take a medication and it causes something just, I guess, more disastrously problematic, like swelling of the hands and feet, something that you wouldn't expect to typically happen, but in very rare cases it occurs.
Go ahead.
and sometimes with side effects, they're more pronounced than others.
Sure.
And so sometimes somebody might experience some side effects, and ultimately you decide after consulting with the patient to leave them on the medication, maybe change the dosage, right?
Yes.
But with an adverse effect, you would be more likely to consider removing them from that medication. Right?
Yes, and that's a great definition of an adverse effect. If somebody's having swelling of hands and feet, they just need to stop taking Remeron and we'll find something else.
Okay. Are there other adverse effects for Remeron that you're aware of?
Not that spring to mind immediately.
Okay.
I don't have anybody taking Remeron right now. Typically when I work in the hospital, I'm working with people who are psychotic or who have mood problems, and I don't really prescribe a lot of antidepressants anymore.
But there are additional adverse effects, you just can't remember.
I'm sure there are. I'm sure if you look it up, there would be an arm's length.
Talking about Depakote, there are side effects to that as well, correct?
Yes.
As well as adverse reactions effects,
Yes.
right? And some of those side effects would be diarrhea, right?
Yes.
Dizzy-
Upset stomach.
Dizziness,
Dizziness.
drowsiness,
Yes.
blurred vision,
Can be.
tremors,
Tremors. Hair
weight
loss.
changes.
Weight changes. Hair loss is another one that's very common with Depakote.
Hair loss?
Hair loss, yes. Sorry, Your Honor.
Go ahead.
And this might be crossing over into adverse effects, chest pain.
Not typically chest pain with Depakote. The adverse effects for Depakote would be your blood count gets lower, so I'm looking at platelets, I'm looking at white blood cells, and so when I prescribe Depakote in the hospital, I set up so that the person every 3 months gets labs drawn so that I can check to see if any of these problems are happening in the blood. Another really common adverse effect of Depakote would be that it might mess with your liver. So there are some labs where we use to check liver enzymes, and
Okay.
if liver enzymes go up, we know that Depakote is negatively impacting your liver.
Okay.
And at that point, we see if we need to change, decrease the dose, or keep it the same.
Okay. Pancreatitis also?
Yes.
with Depakote?
Very common.
And then the possibility of some other mood problems, correct?
I would say Depakote is a mood stabilizing medication, and so it tends to help with mood problems rather than create them. Depakote also is good for seizure disorders, and so not everybody it's not only used for people with bipolar disorder and manic episodes, it's used for seizures frequently as well.
You said that you reviewed records from Lori Jerkovic, correct?
Yes.
And according to your review, Hemy saw her in December of 2010, right?
Yes.
Twice in one day?
Yes.
And she's a therapist, right? A
Yes.
licensed therapist? She's
Family counselor.
right. She's not a psychologist, as far as you know.
She is not a psychologist or a psychiatrist.
And you're not aware of her being a forensic evaluator?
No, I'm not aware of that.
And you reviewed Pamela Crawford's interview. You testified that you'd watched the recorded interviews, correct?
Yes.
The emails that you reviewed between Hemy Neuman and various different people, including Andrea Sneiderman, right?
Yes.
Melanie White.
Yes.
The emails with Melanie White, those are the ones where he was telling her about his relationship with Andrea Sneiderman. Do you remember that?
Yes.
And soliciting her opinion?
Yes.
And you said you did not actually speak with Melanie White, you just listened to her interview, right?
That's correct.
So from listening to that interview, you know that she was his real estate agent, right?
Yes.
And you saw the email that Hemy sent to his wife, his children, and various friends and family, right?
Yes.
Telling them basically that he was leaving his wife, right?
Yes.
And you didn't talk to anybody to find out if that kind of email was the norm for him, did you?
I did not. I reviewed emails, but no, I did not talk to anybody.
You saw emails that he sent to some of his GE coworkers, specifically when he was in the hospital in December, right?
Yes.
And in those emails, he was sharing details of his recovery, right? And when he
Yes.
might be released from the hospital. You didn't talk to any of the GE folks to find out if he normally shared information like that with them, did you?
I did not.
But you know from your review of the interviews with the GE people that he wasn't the type of person to just walk around sharing personal details, right?
They say that, but then there's evidence that he was talking to Orna Hannison about the affair, who's a former coworker at GE, and Jim Bono. And so they say that he's not one to share details, but then there he was sharing details.
Right, and those conversations took place during this time period from the summer of 2010 to November of 2010, right?
Yes.
In the emails between he and Andrea Sneiderman, there were several emails where he expresses his feelings for her, right?
Yes.
Very clearly, right?
Yes.
I love you, right?
Yes,
Marry me, right? In one of the emails, he talks about a time they spent in Greenville where he says, other than the birth of the twins, this was the most beautiful, wonderful time of my life. Do you remember that email?
Yes.
Emails saying, I know how to make you and Sophia happy, right?
Yes.
I can give you, Sophia, and Ian the world, right?
Yes.
There is no email that you reviewed from Andrea Sneiderman to Hemy Neuman that expresses that level of feeling towards him, was there?
No. When I was evaluating what her level of feeling toward him was, it wasn't necessarily in the emails, though her emails do express that they were involved,
Right.
More than just friends. I thought what was really meaningful was the interview with Christy Oliveira, who witnessed them in Greenville. What she said was they were very much acting like a couple, and dancing, and she was giggling, and it seemed mutual.
Right, but we're talking about the emails right now, and the emails specifically from Andrea to Hemy Neuman.
Yeah, specifically about the emails, I thought the emails showed, my impression of the emails showed that they had a mutual interest, but that his interest was more interested than hers.
Correct. So when he said, marry me, she didn't say, sure, let's go?
Correct.
She didn't say, okay, I'm going to tell my husband tomorrow, right?
No, it's my understanding that she said, I made a commitment, and I'm not breaking that commitment.
Her response to his email regarding the Greenville experience being the best thing since the birth of his twins was, it was the best night she'd had in a long time, right?
Yes.
want to talk about the medical and mental health records that you reviewed for this case. Georgia Regional, it's Georgia Regional Atlanta that you work at, right?
Yes.
And that's in DeKalb County, right?
Yes.
And you work sometimes with folks who are in the jail, right?
Yes.
And so you're familiar with the DeKalb County Jail, right?
Not that familiar. I'm more familiar with the Fulton County Jail.
Okay. Do you know what 3A is at the DeKalb County Jail?
I don't know what 3A is. I'm sorry.
Are you familiar with a portion of the jail, whether it's Fulton County, DeKalb County, any jail really, that has a specialized mental health unit?
Yeah, I know that in the jail there is an infirmary where a certain number of patients go when they need closer scrutiny for whatever reason.
And from your review of the records, you know that Hemy was housed in this unit, right?
Yes.
For a period of time. And you know that he was screened for mental health problems when he was initially arrested in January of 2011, right?
Correct.
And at that time, he said that he was experiencing no delusional thinking and no hallucinations, right?
That is correct.
Is there any indication from what you reviewed that when he was screened, when he was responding to those questions, that he was actively delusional?
Yes, actually. When he met with Dr. Flores in September, I believe it was September 2011, he told Dr. Flores that he believed he was the father of the Sneiderman children. And when he met with Dr. Crawford in November 2011, he said that he believed that he was the father of the Sneiderman children. It's important to note that, at least with the interview with Dr. Crawford, it was taped, and so I could see his behavior, and he didn't demonstrate anything that indicated any manic behavior. So there you have that inconsistency that I was talking about before, where he had a delusion but no associated manic behavior.
Okay.
Now, this is a long answer, and I'm sorry. My point is that in October, he goes into this infirmary area. In September and November, he's still delusional and by all accounts should be manic. But you have this October, him going into this infirmary area, but there's no records from that period of time that indicated he was in any way manic, delusional, hallucinating, anything.
Okay. Well, I was actually referring to the intake when he was arrested in January of 2011. So I apologize for not being clear about that particular question.
No, so when he was on intake in January 2011, my read of the intake form was that he denied any mental health symptoms at that time.
Okay. He did tell you about previous suicide attempts, right?
Yes.
And you saw in those, in your review of those records, that he had indicated previous suicide attempts to the jail staff, right?
Yes.
As well as to Dr. Crawford, right?
Yes.
And Dr. Flores, right?
Yes.
And other mental health personnel that he spoke with, right, at
Yes.
various times? Your review of the documents showed that, in talking about October 2011, he let the jail staff know that he was having thoughts of harming himself, right?
Yes.
And at some point, he was transferred to another facility, right?
Yes. I believe that was April 2012.
Right. And your review of the records show that he was diagnosed by that facility with bipolar disorder, right?
Yes. At some point after that transfer, he got diagnosed with bipolar disorder. And records from that time are pretty scant.
Okay. But clear that he was diagnosed with bipolar.
Yes, clear that he was diagnosed with bipolar disorder, definitely.
And they began treating him for bipolar disorder.
Yes.
Right? They began therapy with him, correct?
They did.
And then they actually began him on medication in April of 2013, right?
Yes. And the note where they talk about the medication, they list a dosage of Depakote that doesn't make sense.
Okay.
It says the dosage of Depakote is 100 milligrams BID, which means 100 milligrams twice daily. Depakote isn't dosed in 100 milligrams. It would be dosed in 1,000 milligrams. Okay. So that dosage might be 1,000 milligrams BID. But then lower in the note, it says that they're going to reduce it slightly, and then they reduce it to 750 milligrams just once daily.
So that could have been a Scribner's error?
I'm not clear what dosage of Depakote they were starting with to reduce it.
Okay.
So that, again, that note was a little chaotic.
Okay, so what you're saying then is that you're not sure whether that's a Scribner's error or a mistake on the part of the prescriber.
Yes, I have no idea, and I think that prescriber is deceased.
Okay. And we talked about the medications that he was prescribed, Depakote and Remeron, right?
Yes.
And those are the medications he's remained on,
Yes.
right? In various dosages.
Yeah,
right?
there's been a couple of dosage changes.
And whenever there's a change in dosage, there has to be an order or a prescription from a medical professional to change that dosage, right?
Yes.
And that person can't just be a technician or a person who works at a facility who just hands out medication, right?
No, a mental health, a prescribing physician has to
Right.
order that.
And so you know from your review of the records that there were multiple doctors or providers who ordered or prescribed these medications for him between 2013 and 2016, correct?
Yes.
Not just the doctor who's deceased, right?
Right.
I'm going to talk a little bit about hallucinations. Genuine hallucinations are generally heard outside of the head, right?
Not typically. In my research for this case, I found that there's some mixed literature on that, and that shouldn't be used. In the past, I have actually testified to that, and I have said that in court, that typical hallucinations come from outside of the head, and now I have to evaluate that a little bit more stringently.
They aren't generally continuous, meaning you hear them 24/7, right?
No. The people have strategies to make them come and go.
Okay. And the content of the hallucinations is often mood congruent, right?
Often.
And I think you testified before that with delusions, a person who is delusional doesn't know he's delusional, right?
No. A person who's delusional doesn't know that. When someone is treated, sometimes they will have insight, and insight is a very important thing. Insight means you understand what's happening to yourself. So after treatment, then people might have some insight into their delusion, but while a person is delusional, typically they do not have any insight.
And so a person who is delusional and hasn't been through any treatment wouldn't typically question the delusion, right? Because they think it's true.
Correct.
They wouldn't try to analyze it and see if it made sense.
Oh, nor would they hide it.
Bipolar disorder. And you talked about manic episodes, and I think that according to the DSM, there has to be, a manic episode has to last at least a week, right?
Correct. Or shorter if it requires hospitalization.
Okay. And have at least 3 of a list of symptoms, right?
Yes.
And you talked about some of those symptoms, and we've heard about some of those symptoms from other witnesses. But one of the symptoms is increased goal-directed activity, right?
Yes. And I want to put a caveat on that and say it might be goal-directed activity, but that I don't want that to imply that it is successful goal-directed activity, because people, again, might want to transcribe every single page of the Bible and set out to do that, but then wind up writing a disorganized mishmash of nothing.
According to the DSM, that goal-directed activity often consists of excessive planning, right?
Yes. To the point where one can't follow through with planning.
And participation in multiple activities, right?
Yeah, participation in multiple activities. Again, with a manic person, it would be 1 minute they're writing a long rambling letter, and then the next minute they jump up to pace around the unit.
Somebody experiencing a manic episode may show increased sociability, right?
Yes.
Talking to people that they haven't talked to in a long time, maybe?
Yes, but in a bizarre way. And like I said, when you walk into the psychiatric unit, the manic person is the first person who's going to greet you because they run right up to you. So
it can be intrusive.
Yeah, and intrusive, I think, is the best word to describe that, because I wouldn't say that a manic person just emails you out of the blue with an organized email and says, hello, I was thinking about selling my house. A manic person is going to send you 19 emails. They're long and rambling and don't make sense.
Bipolar includes depressive episodes, right?
It can, well, yes. It can. It doesn't have to.
Okay.
Bipolar 1.
Okay. And in this case, you've read Dr. Flores' report, right?
Yes.
And you talked to Hemy Neuman about various parts of his life, right?
Yes.
And within that, he told you about periods of time where he felt depressed, right?
Yes.
And depression includes times where the person would feel a diminished interest in pretty much anything, right?
Sure.
They might suffer from insomnia, right?
Yeah.
Which is where Remeron might come in, right? Or hypersomnia.
Yes.
They might feel fatigued,
Yes.
low energy, feelings of worthlessness.
Yes.
Now, feelings of worthlessness, that's not something that you could ask somebody else, hey, did this person feel worthless? Right? I mean, you get that from the person, right?
Yeah. Anytime you interact with a person, you always want to get the person's subjective experience.
Okay. Diminished ability to concentrate is one of the symptoms of depression, right?
Yes.
And again, that's a report you would typically get from the person, right?
Yes. That report, the diminished ability to concentrate can also be shown in work-related activities. So if the person's having job trouble, then you can extrapolate that they're having some problems concentrating.
Or school trouble.
Or school trouble, yes.
Did you review Mr. Newman's transcript from Georgia Tech?
I actually did not.
Did you talk to him about his grades in college?
Yes, he said that there was one semester where he had a struggle with his dad and emotionally was drained and not happy about that. He described it as depression, and he said that his grades suffered in that quarter. It was not a semester.
You're familiar with the American Psychiatric Association, right?
Sure.
It's a pretty reputable group.
Yes, they do good work.
And in fact, they're the ones that are the authors or the publishers of the DSM, right?
I'm not sure.
Can I put this?
Yes, ma'am. You're approved.
Is this the
American Psychiatric Association.
And this is a book you use, right?
Sure. Yes.
Often considered the Bible, right? In
Yes,
psychiatric
especially
work.
for a forensic report. We want to make sure that we look at all the criteria.
I want to talk about your evaluation, more specifically of Hemy Neuman. You said you met with him for about 3 hours and 20 minutes.
Yes.
And he was not exhibiting any psychotic symptoms when you spoke with him, right?
That is true.
And he didn't self-report that he was having any psychotic symptoms at that time, right?
No, not in 2016.
But he did report previous hallucinations, right?
Yes.
Previous suicidal thoughts.
Yes.
And when you talk about malingering, in a criminal case, you always look for malingering, right, when
Always.
you're doing an evaluation?
Yes.
And that's because part of malingering is the motivation to evade, in this case, criminal charges.
Yes.
And did you screen him for depression?
Sure.
Did you screen him for PTSD?
Yeah, we talked about trauma.
Did you do a formal assessment for bipolar disorder?
Yes.
Did you talk to him about hyperreligiosity,
Yes.
hypersexuality?
Yes.
Did you assess him for the hypersexuality outside of his relationship with Andrea Sneiderman?
He said that there was a time where he had, I want to say it was around Labor Day, where he and his wife, Labor Day 2010, where he and his wife were considering getting back together, and he said that he had a lot of sex with her at that point.
So is that a yes you assessed him for?
Yes,
that?
yes, I did.
And hypersexuality is something you would typically get through a self-report, right?
Not necessarily. Again, manic hypersexual people are dressed provocatively. My manic people on the unit tend to masturbate with no regard to whoever might be watching them. It's not that someone has an affair and that they're hypersexual. The hypersexuality of mania is pervasive and it's problematic and it's overt. And so it's something that might come out at work if his clothing changed and he began to dress more provocatively or say provocative things to people.
When you are evaluating somebody and you haven't had information about what he might have done at work or masturbating in front of people, and you're talking to the patient or the person that you're interviewing, it would be a self-report situation, right?
Yes.
You would be asking those questions, right?
Yes.
You might also be able to follow up with somebody who that person is intimate with, right?
Maybe.
In this case, Andrea Sneiderman? Right?
Yes, in this case he was intimate with her and his wife.
Or his wife, Raleigh, right? In discussing his sex life with Andrea, I think you testified that he told you and Dr. Huey that he'd had sex with her about half a dozen times, right?
Yes.
And he also indicated that he had kind of blurred fantasy with reality. He wasn't sure really how many times they actually had intercourse.
Yes, he said that it was at least a half a dozen times, but he's not sure exactly how many.
When he talked to you about the demon, and it looks like he talked to you about the demon at various points during your interview with him, did you ask a question about what was going on with his life at the time that he experienced the demons? Ask him how he was sleeping?
Yes.
How his concentration was?
Yeah, with regards to the demon, the demon didn't come with the time of the crime. So we didn't specifically ask him about depressive symptoms when the demon came, because the demon wasn't relevant to his knowledge of right from wrong at the time. Now, when he was telling us about the demon, he provided to us certain details about how he was thinking and what he was doing when the demon came. But again, that was his self-report, and that was his description of events.
Okay. Did you ask him about symptoms after his arrest?
Symptoms after his arrest.
Of mania or depression?
Yes.
Did he tell you about somebody named David Malachi?
He did not.
Did he mention anything about getting plastic surgery?
No.
Did he mention anything about having 3 houses in Florida and living between the 3 with 2 or 3 families?
No.
Hypothetically, if you had spoken with Hemy back in 2011 and he appeared to you to be delusional then, would that have changed your opinion?
If he appeared to be delusional then, it could potentially change my opinion. Well, what I really want to know is was he delusional in 2010 at the time of the crime? Now, if he's delusional in 2011, that would inform me that he actually was possibly delusional. If he was truly delusional, then yes, that would. I'm trying to figure out how that would make sense in the context of a bipolar disorder, and it wouldn't, because again, you see the delusion, but you don't see any of the manic symptoms, and so it would raise more questions, definitely.
So if you interviewed him in 2011 and you saw evidence of a delusion and manic symptoms, would that possibly change your opinion?
Yes, if I saw him in 2011 and I saw legitimate delusions and legitimate manic symptoms, then that would legitimately give him a mental illness. Now, it's still a leap to go from him having a mental illness to not knowing right from wrong at the time of the crime, because I think there's a lot of evidence separate from that.
Well, you've testified previously that insanity and mental illness are different, right?
Right.
You've had patients who you consider to be suicidal, right?
Yes.
Are they all dead?
No.
So you've seen patients who have tried to commit suicide and failed, right?
Yes.
You've seen and talked to patients who had suicidal ideations or thoughts, right?
Yes.
And didn't follow through, right?
Correct.
And a suicidal ideation is can be anywhere from actually having a plan to just thinking about it, right?
Yeah.
And in fact, most of the time, people who experience them don't actually carry through with it, right?
Yeah, that's correct.
So if somebody tells you that they're suicidal or exhibiting behaviors that you believe are suicidal, you would act on that, right?
Well, what I would act in that I would do an assessment and decide if the person needs any kind of intervention. So yes, in that I would act.
And just because they didn't actually complete the act, you wouldn't say, nah, not suicidal.
No. There's a whole host of things that go into a suicide risk assessment.
Thank you.
Mr. Land, any other questions?
No, sorry, Judge.
Oh, no problem. I'll make sure we're on the same page. Is redirect?
Yes, Your Honor.
You may.
Thank you.
You're welcome.
Dr. Browning, Ms. Deland asked you a couple of questions about the medication that the defendant was on. Do you recall those questions?
Yes.
Okay. And you talked about your familiarity with those medications. Is the dosage that the defendant's on, does that tell you anything?
He right now is taking a reasonably appropriate dosage, and the way that we know that is because Depakote is monitored by blood level. So at every so often he gets a blood level of Depakote drawn, and I think his blood level is appropriate for an effective dose.
And with the medication he's on now, and in the dosage he's on now, and has been over the past 3 years, 2 or 3 years? No, sorry, 3 or 4 years. Is that consistent with somebody who has one of the lesser forms of bipolar disorder that we spoke about earlier?
As far as treatment of bipolar disorder goes, there are people who don't respond to Depakote unless they're given a really, really high dosage. I would say that Mr. Newman's dosage is in the low range of dosages, but I don't want to say that it's too low to be effective. Because it's not, but it is in the low range of a reasonable dosage.
Of a reasonable dosage. All right. In the medical records that you reviewed, they span from 2011 to the present. Is that right?
Yes.
Or when you evaluated them, June 2016.
Yes.
In any of those medical records, is there any notation or any observation or any note at all that the defendant was experiencing psychotic symptoms?
No, it's a lot of self-report of his experience of psychotic symptoms, but no observation of him experiencing any psychotic symptoms.
And when you talk about psychotic symptoms, tell the jury, what was it that you would be looking for? What are you talking about when you say psychotic symptoms?
So psychotic symptoms, again, someone is psychotic when they have a break from reality. So I'm looking for auditory hallucinations, visual hallucinations. Sometimes when people are experiencing those things, they look like they're talking to themselves and they're really responding to those hallucinations. Delusions, that's another psychotic symptom that I'm wondering about.
Okay. I asked you a couple questions on direct examination, and I used the phrase rescue delusion. Do you recall that?
Yes.
Okay. Is that a phrase that you would use?
I don't use the term rescue delusion.
Okay, why not?
Well, a delusion is a delusion, and so, I mean, I get what you mean when you say rescue delusion. Mr. Neuman says that he was trying to rescue the children from harm, and so then that's a rescue delusion. That's just not a term that I think is really used in mental health.
Okay.
It's not one that frankly, it's not one that I've heard of.
It's not one of you heard?
Yes.
Is that a diagnosis in the DSM, the manual that you referred to earlier?
No.
Okay. Could it be noted somewhere in the DSM that that is a type of delusion that some people have, or it's noted that some people have, but itself is not a diagnosis?
It could be notated in the DSM somewhere.
Okay.
It's
But not as a
anywhere.
diagnosis.
Not as a diagnosis, and it's not in the DSM anywhere that I've seen.
Okay.
If it's in there, I'd like to be educated on it.
Okay. But it's not a diagnosis that you're aware of?
Right.
Okay. Miss Delenn asked you about whether the defendant told you anything about, I wrote it down, David Malachi or plastic surgery or houses in Florida. Did he tell you anything about that?
No, absolutely not. I don't know. I've never heard of that in my life.
You never heard of that, even in your review of Dr. Flores' report?
It's not in her report.
What about your review of Dr. Mark's report?
No.
What about your review of the interview the defendant did with Dr. Crawford back in 2011? You talk about David Malachi, houses in Florida, plastic surgery then?
No, I've never heard of that.
Assume for the purpose of my question that the defendant was not consistent in his description of the psychotic symptoms that he experienced. And this is an example of the defendant not being consistent, that he told one doctor that at one point, supposedly, and then did not describe that same symptom among the other doctors that he talked to. What, if anything, does that mean to you?
I would say put it with the rest of the inconsistencies, and that, to me, is more evidence of malingering.
Thank you, Dr. Brennan.
And I have to interpret thank you mean no further questions.
That is what that means. Thank
All
you.
right. Any recalls?
I just have one second.
Okay, that's you may. All right, lawyers, may this witness be released and excused from subpoena. Do you want him to remain under subpoena?
He may be released from the state, Your Honor. No objection.
All right, Dr. Brown, you're free to go. Have a good afternoon. Drive safely.
Thank you.
Yes, sir. Call your next witness, please.
All right, at this time, the state calls Billy Akins.
You may. Billy Akins, come on up, please.
Go ahead and have a seat, please. Please raise your right hand. You solemnly swear affirm that the testimony you shall give this court shall be the truth, the whole truth, and nothing but the truth, so help you God.
I do.
May you go ahead and please state and spell your name for the record.
Major Billy Akins with DeKalb County Sheriff's Office.
Okay. Major Akins, how long have you been with the Sheriff's Office?
I have been with DeKalb County Sheriff's Office 26 years.
Okay. And you said you're a major there?
Yes, ma'am. I'm
Oh.
currently with the Office of Professional Standards.
And did you spell your name for the record?
Billy, B-I-L-L-I, Akins, A-K-I-N-S.
Now, you said you're with the Office of Professional Standards?
That's
Could
correct.
you just tell the jurors a little bit about what that is?
We do internal affairs. We do investigations on officers, handle complaints, manage use of force complaints, and also one of my responsibilities is the custodian of records, which includes the secure system with the telephone calls.
Okay. Now, have you always been with internal affairs or OPS?
No, ma'am, I've been there about 2 years. So I was a jail commander, one of the jail commanders 6 years prior to that.
Okay. And as a jail commander, could you explain to the jurors what that was?
I was the administrative jail commander where I handled intake, booking, our GED program, our medical, any kind of the administrative ends of the jail, and also handled complaints in that division also.
Now, does the DeKalb County Jail have a phone call system whereby inmates can make outgoing phone calls?
Yes, ma'am. Inside of a jail facility, telephone calls is, we call it having a vendor. There's so many calls that are made between inmates and their loved ones on the outside. It's not controlled by the sheriff's office. It's an outside corporation that runs the phone services. They collect the fees on them. They establish the records of all the information, and we at DeKalb County Sheriff's Office maintain an outside vendor called Securus Technologies, and they're based out of Texas. And it's a web-based system that's used nationally that allows all of our phone calls that are made from an inmate from the inside to someone on the outside are recorded and saved for about 180 days. And that way it allows us for investigation purposes to look into any of the calls that are made.
Okay, now you said that they remain recorded and saved for about 180 days. What happens after 180 days?
You can download or save the documents and you can maintain them forever, but after 180 days, just because it's so much data, it's dropped off the system. They disappear forever and you won't be able to pull them back if they haven't been saved.
Okay, now let's be clear. This secure system that you talked about, is it something that just documents whether or not a phone call was made, or does it actually record the phone call?
It records all the phone calls.
Okay. And are you familiar with that system?
Yes, ma'am. I was, one of the jail commanders, I'm one of the main person that brought on this, the program, installed it, and the administrator of the program where I give access to anyone for user capability. I maintain it and have had a lot of training in it.
Okay. Now, when a phone call is recorded into the system, you said it's a web-based system. Is there any way for you or anyone else to go in and change that phone call?
No, ma'am, there's not.
Is there any way to tamper with the phone call in any way?
No, ma'am, there's not.
Okay. And are you able to access the phone call, meaning are you able to download a phone call and put it on, let's say, a disk if requested?
Yes, if you have a user's rights to do so.
Okay, and do you have users' rights?
Yes, ma'am, I do.
Okay. Let's talk a little bit about how the phone system works. First of all, are all inmates given access to the phone system?
Yes, ma'am. Upon being booked into our facility, when you're classified to go up to one of our housing units, you're given what's called a PIN number, and that allows you access into our system.
Okay, and is that PIN number something that different inmates have in common, or is it unique to each individual inmate? Unique
to each inmate. They use your SPIN number, which is the number that is given to you when you are booked into the facility. A SPIN number carries, anytime that you're arrested, you're booked back under that one SPIN number, and it's the last four digits of your SPIN number plus 4 numbers of a unique number that's given to you from Securus. So it's kind of like when you go to the bank and you have to put in your bank card and then you use your personal PIN. It's a personal PIN so that the inmates could use that because the money is on their account. Okay, now when you say the money is on their account, explain a little bit of that to the jury. In order to make a phone call, there's a service charge for any phone call that's made. A loved one or a friend or family from the outside can place money on an account for an inmate to make certain calls to whomever they choose. And you have to have money in order to make a phone call. Okay. And then does the inmate have access to the phone system at all times while they're in the jail? In each housing unit, there's 4 phones on the wall that, as long as you're out on rotation, certain times of the day that the inmates are remain in their private cells, but if you're in the day room, at any time you're in the day room, you can use the phones on the wall. Okay. Now, Major Aikens, we talked a little bit about the phone calls being recorded. Are the inmates aware that the phone calls are being recorded or monitored? Yes, ma'am. How is that? It's in our inmate handbook. It is also stated when you get your PIN number, they show them how to use the system. And then when you make a call, you can hear at the beginning of it that it's notifying the person that's on the other end, whoever they're calling, as well as the inmate. These phone calls are recorded, and it's widely known through the jail.
Okay. Okay. Is it written anywhere in the jail as well?
Inmate handbook, yes, ma'am. it is.
Okay. And describe for the jurors what you mean by inmate handbook.
Inmates are given a handbook, gives the rules and regulations of our facility, and it tries to help them navigate as they learn the process when they come in.
So even if somebody chose not to read the handbook, they would still be notified at the beginning of each call that their call is being monitored or recorded?
Yes, ma'am, that's correct.
Okay. Let's talk a little bit about how it's recorded. Is it something, are the phone calls recorded every single time or just sometimes? How does that work?
Every single time. The secure system allows a user to monitor the calls live, or they're saved for the 180 days, either under the inmate's PIN number, through their name, through their cell number. There's various ways that we can research in order to pull up information on a call that's made, but once it's made, it's automatically saved.
Okay. And it stays in the system for that 180 days?
Yes, ma'am.
Okay.
That's correct.
Now, so once it's automatically recorded, is that something that you, if it is saved in the system, do you maintain those records in the regular course of business?
Yes, ma'am, we do.
Okay. And is that recording made at or near the time that the call is made?
That's correct.
Okay,
yes,
so
ma'am.
meaning if an inmate goes in, makes a phone call, as he or she is making that phone call, is that call being recorded into the system automatically?
Yes, ma'am, an automatic log of all the calls made, yes.
Okay. And is that part of the regular practice at the DeKalb County Jail to record all of these phone calls?
Yes, ma'am, that's correct.
Okay. Now, just to be clear for the jurors, there are going to be some phone calls that are never requested. Is that correct?
That's correct.
Okay. So after the 180 days, would the system just override itself and just erase those calls, those recordings?
You'll see a log that the call was made, that there was a phone call made, but you won't have any of the voice recordings anymore.
Okay. You won't actually hear the people talking in the conversation.
Correct. That's
okay.
correct.
But those are kept for at least that 180 days in the regular course of business activity there at the DeKalb County Jail.
Yes, ma'am, that's correct.
Okay. And, Your Honor, may I approach?
You may.
Thank you, Your Honor. Major Akins, I'm going to show you what's been labeled as State's Exhibit 131 for identification. Do you recognize what I'm showing you?
Yes, ma'am, that's a CD.
Okay. And is that a CD? Were you asked to review a phone call for this case?
Yes, ma'am, I was asked to review it to make sure it was from the secure system and then initial it, and I initialed it.
Okay. And does that phone call accurately reflect a call that was on the secure system on August 4th, 2016 involved in this case?
Yes, ma'am, that's correct.
Okay. Now, just to be clear, you said you reviewed this? Have you
Yes.
reviewed it in its entirety?
Yes, ma'am, I have.
Okay. Did you recognize the male voice on this disc?
Yes, ma'am, I did.
And who do you recognize that voice to be?
Mr. Newman, and it was also when I pulled it up in the system, it was pulled up by Mr. Newman's. I pulled it up various ways because I knew I was going to have to authenticate the record, so I pulled it up under his name, and that call came up. I pulled it up through his PIN number, the call came up. I heard his voice and recognized it from having conversations with him while he was in custody. And then I also pulled it up through the phone number, so I checked it multiple ways to confirm.
All right, ladies and gentlemen, this is a break time, and this is item number 131, and you're ready to pick up your questioning on the other side of the break. All right, ladies and gentlemen, during this break, do not discuss the case. I always want to discuss the case with you. If you do decide to have a meal here in downtown Decatur, do not sit next to anyone who may be discussing the case. I allow anyone who sit next to you who may be discussing the case. Either A, move away from them, or B, move away from you. Do not remain upon the fifth floor, because I don't want you to interact with anyone you should not interact with during this break. Do not read or look at any media coverage pertaining to this case. Do not go upon the internet, do any research about this case. Do not blog or write about this case while it's ongoing. Do not go to any location that may or may not have been made reference to. All the evidence will come to your formal sworn testimony from this witness stand and on evidence that's introduced during the course of the trial. You're more than welcome to bring something to snack, or eat pizza in the afternoon session. Do not consume any alcoholic beverages during the lunch break. Please turn your cell phone communication device to the off position so that it will not really mess when you come back. That way they won't be disrupting the court during the afternoon session. This is your opportunity to make communication with anyone you want to, return calls, return messages, return texts with anyone you want to. just put them in the opposition and come back. As a reminder, as I've told you many times, the lawyers and the parties cannot talk and interact with you outside the courtroom. I don't ever want you to think they are being rude or discourteous or draw any emphasis from that one way or the other. They just cannot interact with you based on the directive of the court. We're going to be in recess until 1:30, as we always do. If you're early, you can't be late. Give yourself enough time if you do decide to leave the parking garage, to leave the garage, be back in time to park your car. Come back through the front doors, you have to go to the metal detector, you have to ride to the fifth floor, or if the elevator's not working, you have to walk upstairs. I know the air conditioner is working and it's very cool in here, but I'm reluctant to ask them to warm it up. So you're going to be cool. Just let you know that. So if you want to either retrieve a sweater like some of you have from your car or home, wonderful. But this is where the temperature's going to be all afternoon. So just to let you know that if you want to run to the store and buy yourself a sweater, you can. But this is where it's going to be. I'm not going to ask them to warm it up. So just putting you on notice, this is how it's going to be all afternoon. Very comfortable. It's comfortable with me, so it's going to be comfortable with you too. I appreciate you having a positive attitude. Appreciate you being on time. Follow the instructions of Deputy Garrett. I'll see you back at 1:30. 1:30. No 1:30 links, no 1:30 skis. I'll see you back at 1:30. Keep your notepads there in the jury room, turn the face down. If you need additional pads, you'll have those available for you. But I'll see you back at 1:30. 1:30 today. Mr. Deputy, we're in recess till 1:30. All rise. You may be seated.
Excuse me.